Hey everybody, I'm Dr. Tim Lenahan. I'm a chiropractor here in South Amboy. Today we're putting together a video to demonstrate the proper use of the foam roller on the IT band to encourage mobility and less stiffness and discomfort, specifically in the knee joint. People have been having to sit at home much more often than they've had for the past several months. So we have been getting much more complaints about knee pain and stiffness. So we decided to put this video together to make sure that we can remain mobile and active, which is a great thing. Hang tight. Okay, so we're gonna demonstrate the use of the foam roller. We're gonna start actually on the left side. You're gonna place the foam roller so it's perpendicular to your body. The left leg is going to remain completely straight, and you're going to place the foam roller directly beneath your hip. You do not want to be on the hip bone. You want to be below the hip. So with your leg in a completely straight line, you're going to take the opposite leg, which in this case is your right, going to bring it in front with your knee bent, and with your foot on the floor, this right leg is going to be the leg that allows you to move forward and backward. You're going to slowly roll up and down on the IT band in about a strip of 6 inches, really, really slowly. And as I explain to my patients, if you're doing this and this does not produce discomfort, you're pretty much wasting your time. The IT band, when it's tight, will be very, very sensitive as you go to roll on it. So right now I'm rolling, and this isn't terribly uncomfortable, so I'm gonna go a little bit closer to my knee where I find a sore spot. And once I find that sore spot, that's where I'm going to be rolling for maybe a minute or two. If an area is really, really tender and tight, you want to roll nice and slowly. You can feel free to take breaks as needed, but what I recommend is you set a timer on your phone for about 5 to 7 minutes. That is to say 5 to 7 minutes per side. Take breaks as you need to. You want to slowly move closer and closer to the knee, but you're only rolling within 6-inch length. Keep in mind, as you roll consistently, the area that you're working on should become, over time, less sensitive. Okay, so with the foam roller, it's important to remember never to roll over any joint. You do not want to roll over the hip. You do not want to roll over the knee. You want to stay in between the knee and the hip. You want to take your time. There's no rush when you do this. This will be sore and sensitive. It's okay to take breaks as you do this. If it gets to be too intense, go ahead and take a break. But the more consistently you do foam roll, the easier it's going to be, the more flexibility you're going to have in your knee, and because you feel less pain, the more active you're going to be. So as far as frequency goes, you want to be doing this every other day. That way, and again, 5 to 7 minutes per side every other day, so you give yourself a day to rest. Over time, you're going to be feeling consistent relief, improved flexibility. You're going to be feeling fantastic. If you have any questions about this, feel free to reach out to us. I'd be more than happy to answer any questions that you have. Take care.